Hi guys, good afternoon everyone. I hope everyone is doing fine. Uh, Today, guys, we will make an introduction session about SCA. And why we are doing this? Because many people asked about many points to clarify, from where they should start, how they should start preparing, what are the available resources, and many things. Even until today, many people are keep texting us, guys. They didn't pass the exam first or second time. What was the problem? Did they struggle with something in particular, or what exactly is the main issue? So we decided to make this session to clarify many points for you and to put a clear plan, guys, or a clear map for you while you are preparing for your SCA. We'll discuss about many things today. So please, guys, mute yourself. No questions allowed in between or during the session. However, after the session, if you think there is no thing that we or you have any questions that I didn't answer in the presentation or in my talk today, you can ask it at the end. What is the agenda for today? I will just introduce myself quickly with few slides about myself. I try to make it as short as I can. That should take about 5 minutes or 7 minutes maximum. And then we'll discuss about SCA, about the exam, about how you can start preparing for the exam, little bit about the whiteboard, common mistakes that many people, unfortunately, until now, they still doing these mistakes. Even people who are going for the exam after 2 weeks, they are still doing the same mistakes. So we'll discuss about common mistakes people do during preparation or during the exam, and then what the examiner is looking for. After we finish everything, then guys, we will have 3 or 4 people who did pass the exam last month and the months before with high score, just to share the experience with you. If you have any questions to them, you can ask as well. And then we have Dr. Shata. He will talk about board engineering. He did listen to our board style before his exam. It was really very helpful for him. He did just a little bit of modifications. You probably also can benefit from his experience. And then he will also discuss about how you can use the AI to prepare for your SCA exam. We have integrated a tool with Imtiaz Academy, how you can use AI as well to help with your SCA exam. You will find the tool on the Imtiaz website as well. We'll discuss all of that today, guys, in a bit details. Let's make it short and we'll start straight away. So who am I? Okay, so I don't know if someone is attending for the first time, but my name is Amr Ibrahim. I'm a GB in Northwest at the moment. Just a little bit of my background in brief, why I'm interested in teaching, because this is all my career since undergrad as well. Since I was in the medical school, undergrad, I was giving teaching sessions to my colleagues. Not only this, after I finished my study in Egypt, I was a teaching assistant in my university in Egypt, and I got 3 scholarships to study abroad: Japan, Korea, South Korea, and Germany. So I did choose to go to Japan. And here I started to go in more details and more deep in academic pathway, because I was a teaching assistant in Japan, a researcher in Japan as well. And I did many teaching in Japan to Japanese doctors, Japanese students while I was there. And that's why I'm interested more in the academic pathway. So work and teaching experience, as I mentioned, I'm a GP now in Northwest, and I'm one of the instructors in Imtiaz Medical Academy. The academy has been expanding recently, and we have more than 8 qualified GP. We have more than 8 qualified GPs. Most of them, guys, did pass the exam with high scores with us. Even some of them did pass the exam more than 105, 106 score. Teaching assistant. I was teaching assistant in Tsukuba University in Japan, one of the top universities in Japan, and I am a lecturer in Alexandria University. I did used to teach medical English and communication skills to Japanese doctors and Japanese medical students in Japan, in Tokyo, in one of the companies, recruitment companies, like locum companies for Japanese doctors, Creek and River Company. And I also did do some teaching sessions to Japanese doctors about USMLE, because I did USMLE before. Some of the certificate, guys, while I was in Japan, while I was giving courses, advanced medical course, I was the main instructor in this course, and I did the course material by myself. I have written the curriculum for them. Also, as you see here, I also did help with USMLE. plus the one-day medical course about common situations and consultation skills and communication skills as well to Japanese doctors. And that's why it is my interest even since I was undergrad and postgrad, even before coming to the UK. Lots of certificate, guys, I did get before. I put just some of them, not all. So one of them even from the UK. Research experience, you don't need to know that much about it. I did lots of research. I did 5 publications. I did work with Professor Tasuku Honjo, a Nobel Prize winner in Kyoto University as well, while I was working with his team in cancer immunotherapy. So I did lots of experience, of teaching experience. Some of the publications I have did. That was my first author paper in Nature Scientific Report, and those are the publications. One of them was in the UK. Just that is a little introduction about myself, because you should also know who is giving guys the course in Imtiaz Academy and some of the instructors. So we'll try to update the instructor details on our website just to have more instructor details so you know our team very well. I'm sure guys who did the mocks with us already know the team, especially the OnlyU mock. You met many instructors in the OnlyU mock, not only me. So we'll start now, guys, talking about the simulated consultation assessment. Simulated consultation assessment, or SCA. Very important to know, guys, how you can plan for your preparation ahead of your exam and booking the exam and paying the money for the exam. That exam is totally different from PLAB. I know, guys, many of you did pass PLAB. I did pass PLAB. Almost I passed the 18 stations in PLAB. Okay, so PLAB is totally different from SCA. PLAB is something very junior level, very basic stuff. They don't look for high communication level or high communication skills level. It's very basic. If you go for SCA while you are keeping in your mind that I passed the PLAB, I have no issue, you are in a big trouble. You need to tailor your style, your approach for SCA exam. In PLAB 2, they were marking you against other immigrants. In SCA, the main issue here, you are getting the assessment against your British colleagues. Okay, that's why they are expecting higher and higher from you in SCA comparing to PLAB 2, because the assessment criteria or the comparing criteria, they are comparing you against British colleagues. That's why you need to start earlier. You need to start preparing and work on your communication skills, phrases, how you build a rapport, showing empathy, addressing eyes, all of that. Okay, so I hope, guys, don't be misled, because I did see that in many people. Even they rush to book the exam without even knowing too much about SCA. And why they rush? Because they passed PLAB 2 with high score or from first time. Take your time. It's totally different from PLAB 2 exam. So this exam, the main part is management, because this is the higher score or the higher marks in management. And unfortunately, many people do struggle in the management part. Okay, so many people unfortunately struggle with the management part, despite being aware of all the guidelines, know all the management plan, but they struggle to make a management plan, verbalize a management plan in the way that the examiner is looking for. And we'll discuss about this briefly today. And we did already discuss about this management plan in the IPS workshop, how you can make a management plan in the way they are looking for. Then communication skills, IPS, related to others, all of that are related to each other in the same section. Very important. And in fact, guys, IPS can help you clearly to pass the SCA exam, because it can improve your score in management. And IPS is something that you can gain by practice with your study partner, knowing some phrases, so it will sound natural in the exam. Don't assume you will try to make it in the exam for the first time. No, it needs practice and practice until you find the easiest sentences for you to show empathy, to reflect, to pick up the cues, all of that, to start your consultation, to end your consultation, to start your management plan and telling him management options. History taking is also very important, but most of the colleagues don't have any problem with the history taking, or little bit problem with history taking. And I would say maybe 90% of our colleagues, even who did join our academy and they didn't pass before, they didn't have any problem with the history taking. The main part why they failed was management and IPS. And here it comes as the idea of IPS and management course. because it doesn't matter if you know all the details, if you know all CKS guidelines, if you can't verbalize the management plan in the way that they are looking for, unfortunately, you are at high risk of failing the exam. How long you need, guys, to prepare for the exam? If you are first-time taker, you take it for the first time, I would say 2 to 4 months. Okay? At least. It can take up to 6 months if you didn't perform well during the 2 to 4 months period. So don't rush for the exam to book it before you know, are you ready for the exam or no? Again, don't book and pay 1,200 for the exam without getting a good feedback from someone, guys, who knows that what exactly they are looking for. Otherwise, you would be under stress. Many people booked for the exam and they done the mocks 1 week or few days before the exam, and unfortunately, there was many things that were missing from them. And if someone is coming to you taking the mock only a few days before the exam, and you find many things are doing wrongly, it is quite hard to give them a very hard feedback, because their exam after 2, 3 days or 5 days from now. Otherwise, they will be very stressed. So you don't give them a very harsh feedback, unfortunately. But the best time to take the mocks, we'll discuss about this later. But generally, for the first time takers, guys, at least 2 to 4 months. It can take 6 months, even it can take more than 6 months. Give it a time, because it really needs time. It needs time to know what they are looking for and how to run a very good consultation from A to Z. If you are second or third time takers, it depends, guys. It depends on your score. It depends on your score. And we have our colleagues today. They didn't pass from the first time, and they joined MTS Academy. And some of them, guys, they only had the result, and then they booked the next available exam because their level was really good. Only minor things they needed to correct in the approach. However, if your score was 50 something, 60 something, I would suggest take your time and give it 2 to 4 months. If your score, it was only few marks, like a couple of marks or 3, 4 marks until you pass, maybe 1 month or 1.5 months is okay, or 2 months is okay. But if your score, guys, was 40 plus, 50 plus, 60 plus, I think you should stop. You should think again before booking the exam, because definitely there is something missing. Your score less than 70, so there is something missing. So you should stop and don't pay the money again until you are really very well prepared. So if you are third or second time taker or more, please, guys, it depends on your score. It depends on your score. So try to ask someone a very honest opinion when you should take the exam. And we have many, guys, free mentor sessions as well we offer with the instructors. They can sit down with you, see what you have done wrongly before, what you have done wrongly in the preparation, and they can give you a small plan, what you need to do and what you need to work on. And we have done this with many colleagues before. Resources, CKS guidelines, definitely, guys, is the first resource. And what we are doing in MTS Academy and MTS courses, we are taking the CKS guidelines, we are trying to summarize them in a tables, and we are adding them to our notes. So you will find the notes. I believe, guys, some of you already on the course, and many of you already have the hard copy. You will find in our notes, the first 2 pages in every case is all you need to know. After that, you will find few pages extra from CKS guidelines if you would like to top your information up, and if you would like to know more about the condition or about the disease or about the guidelines of CKS. That's why you will find extensive notes, little bit, but believe me, you don't need all of this. You only need, in every case, 1 or 2 pages, the first 1 or 2 pages, other notes just from CKS in a well-organized way to get you all the knowledge you need as a GP. It will help you to pass the exam, but again, you will need them as a GP. Then we have, guys, different kind of mocks, and we are happy and we are proudly to announce that we are the first academy to make the mocks exactly like in the SCA exam. We are the first people to do a circle mock. Not only this, even the feedback itself is very similar to what you are getting in the exam. We are doing big mock, and it runs in a way that 6 candidates take the mock at the same time. You stay in the room exactly like in the real exam. You stay in your room. Every 15 minutes, a different role player will come to you. Most of them are well-trained British role players. Every 15 minutes, you are seeing someone different. They are not medical professional. They are non-medical. Okay? That's why you need very carefully to explain everything in a very simple way, avoid medical jargons, and try to use a very simple language with them. Okay, so this mock, the big mock, we'll discuss about this in more details. So one of the mocks, very similar to exam situations in a circle. Not only this, you are getting the feedback from 6 different GP, qualified GP. So you get the feedback from 6 different GP from our instructors. If the 6 different GPs told you you fail or you get red in most of the stations, that means you are definitely not ready for the exam. Don't risk, don't book and pay the money without doing at least one big mock few months before the exam, couple of months, or before paying the 1,200, just to do one big mock, see the feedback. Did the 6 instructors agree that your level is really not good? You are getting 4 stations red or 5 stations red or 3 stations red. That means you need more time. Give it again 1 or 2 months extra to prepare. Then we have different mocks. We have also the 12 case mock. We have the only you mock, which is one-to-one instructor mock. Okay, we'll come to this in a more details later. So resources, CKS guidelines. In MTS, we are following CKS guidelines. We are summarizing them. We have our different style of mocks. Okay, and in fact, we are leading in the mocks. And it is not only my words. Many people who passed the SCA exam found our mocks are very realistic, very near to the exam situation, exam stress, all of that. Then your daily GP life is definitely very important for the exam. So you listen to the approach, you listen how to make a management plan, you listen to how to run a consultation in the course, then you apply this in your daily GP life, and you mark yourself. Did you do that really or not? Okay, even if you are on 15-minute consultation, what I used to do, I used to put a 12 minutes timer in front of me, and I told the patient clearly, because I'm training myself for the exam, the consultation, although it is 15 minutes, we try to finish everything in 12 minutes. I'm happy in the last 3 minutes to do anything extra you would like. So listen to the approach, practice on the approach, okay, and apply that during your daily GP life. Plus, all the cases you will find in your daily life, you will have it in the exam. Diabetes, you will have it in the exam. Obstructive sleep apnea, hypertension, atrial fibrillation, contraception, HRT, all of that, okay? So, in fact, you are preparing yourself very well during your GP sessions every day. But the idea here, how you can use your sessions effectively, okay, in the way that it will be one of the resources for you, you need to apply the same approach that you are doing with your study partner in the evening. You need to do that in the daytime during your work. Tutorial, try to use your ES, education supervisor, is very important as well. And in fact, my ES done a very good job with me during my tutorial sessions. She taught me many things, how to make a shared management plan, how to make options. Even if you don't have options, try to find any options. Even if it is not following clearly the CKS guidelines, you probably can tell it in a way, and we did that also in the course, how you can also sell any management plan, even if it doesn't follow the CKS fully. If it's not even licensed, how you can apply it to the patient. Okay, if you don't have too much options, you still can find some options, but make sure it is safe options and it makes sense. Weekly teaching, definitely. If you are attending your weekly teaching, they run some topics about SCA. Even sometimes they do some mocks, guys, in the weekly teaching. Try to attend all of them. And AI, practice with AI. Dr. Shata today will discuss this with you guys, how you can use the AI to prepare for the exam, especially if you have time, or if you struggle to find a very good study partner. So courses and mocks. Many people did ask us, guys, about what are the courses available and what is the difference. And we'll try to make it clear on the website very soon. So we have the SCA extended course. This is the first course. And we started with this one. And why we started with this one? Because we wanted to make everything in an interactive way. We wanted people to see how the consultation should be and how the feedback should be. And many people did follow that, especially in the extended course. If you register with that, you will listen to the many mocks. Many of them were done by British role players. So you see what are the mistakes your colleagues are doing. And definitely, guys, most of us will do the same mistakes. So you see what other people already done wrongly in that. and what you should avoid, what you should work on. So we have different courses. The first one is extended course. Should you take it or not? It depends if you have time or not. If you have time, I highly recommend to start with the extended course. You will listen to hundreds, more than 200 cases in a very interactive way. We ask people in the session. I'm sure, guys, most of you or some of you attended before some of the sessions, the free sessions, is very interactive. We ask people how should be the history taking, how should be the management, and then we give a presentation about the case, and then we have the mini mocks. You listen to the role players, you listen to your colleague, you listen to the feedback. So you see how the feedback is verbalized, so you can use the same technique while you are doing your practice with your study partner. You will find it on the website in a 3 duration options: 4 weeks duration, 12 weeks duration, 52 weeks duration, or 1 year. If someone would like to start very early, guys, all of them have the same content. All of them have the same content. Only the difference is duration access. Okay, so many people did ask me, so I hope it is very clear now. The only difference is the duration access, but the contents are the same. Then we have, guys, the crash course. And the crash course came, the idea to make the crash course was in January. For the people who were sitting February, January, for the people who were sitting in March. So the idea of the crash course, if someone doesn't have time, if someone would like to listen to the cases back to back in a less interactive way, they don't want any mini mocks because they just need to listen to a cases back to back. So far, we are having in the crash course more than 250 cases. And this week, Tuesday or Wednesday, okay, we will do another session update for crash course. There are also like about 5 cases new we will discuss, like new ideas, again, from your daily practice. We will, and from the common situations you can find in your daily practice, we'll discuss them in the crash course this week. Crash course, okay, so you can finish it very quickly. You can run all of them, guys. You have the option in all the courses. You have the option to speed the the voice speed up, to increase the speed up. You have 1.5, 1.72. So you can even finish the course in a short duration. What is extra in crash course? You have audio files. So if you are driving, you can just turn on the session. You listen while you are driving or doing whatever you want. You even can turn anything else in the background. Crash course, it has only 2 options for duration, only 5 weeks and 9 weeks duration. And believe me, both of them are very enough. Even 5 weeks, if you would like to finish in 5 weeks, you can do that. You only speed the video up, okay, increase the speed, and you can finish it in 5 weeks. Some people would like to start early, and they would like to listen to it many times, so 9 weeks is a good option. You don't need more than 9 weeks for the crash course. There is no any mini mocks, less interactive, so you can finish it very quickly. Right, and crash course, the cases are increasing little by little. We also increase the cases in the extended course. We have done that last week, but again, for the crash course, the cases also, we are increasing the number of the cases on a monthly basis. Then the last course, or I would say it is a workshop rather than a course, we have started the first run. That was last month. It was really very good. Many people did like the course, because this SCA exam is not only about the cases, the management, the history taking, and that's it. If you can't apply this in the way they are looking for, you will be struggling to pass the exam. That's why we started the IPS course, and we started the course because many colleagues asked for some sessions only for consultation skills and IPS. How you can, in a very easy way, especially we are not English. I'm not native English. Most of us guys are immigrants, so English is not our first language. How can an immigrant pass this exam with a very, very basic communication skills and IPS relating to others? So it came the idea of making a communication and strategy course for IPS and situational management workshop. The next run for this, it will be next weekend, 24th and 25th of May. That is mainly for June and September taker. If someone would like to know the approach early before September exam, so you can apply this while you are practicing with your study partner, this is a good time to start now. So you can build up a good consultation structure early during your practice. Otherwise, you will waste some time, and then you will find yourself, I'm not doing in the wrong, I'm not doing in the exact ways you would like me to do. So you will again readjust your consultation skills and consultation technique. So I highly recommend try to take the IBS course quite early. So you will build up a solid background, how you can apply a very basic strategies, very basic communication skills, and how you can use them to make a very effective consultation very early before your exam. So it will be very natural for you guys in the exam. So it is on a monthly basis almost, or every 6 weeks, we are running this workshop, and it is very interactive. It is on 2 days so far, 4 to 5 hours every day, and you have breakout room, and in every room you will have one instructor. This course is run by 3 instructors, me, Dr. Irbaz, and Dr. Mo. You will have in every room one instructor, and then we will give you tasks, how you react in different situations, and people engaging, how you can react, what would you say in this situation, what are the alternatives, how you can ask about impact in a direct and indirect way, all of this. Okay, so these are the main courses, guys, that we are offering at the moment. We may offer extra courses soon, but these are the main courses that we are offering at the moment. MOOCs, we have different MOOCs. I put here only 3, but in fact we have more than 3. Big MOOC is a very good MOOC, and that's where we started in Irbaz Academy, in the same way, again, in the same way, in a circle, exactly like in the exam. You will have 6 cases back to back with role players. No one is watching you. It is you, the role player, and one of the team, the IT member of the team. They are with you guys in all the rooms. If any problem in the MOOC, if you didn't hear clearly, if there was any IT issues, they will sort it for you. Sometimes it's the same as in the exam. We will repeat the case at the end for you if there was something happening. That is for the big MOOC. Only a MOOC or one-to-one MOOC. In fact, it is not one-to-one MOOC, it is two-to-one MOOC. And why it is two-to-one MOOC? Most of our one-to-one MOOC is run by 2 instructors and one candidate. You go for the only you MOOC. What happened? You will have 6 cases back to back. You are doing 3 cases with a different instructor. So you will have a feedback from 2 instructors. Everyone will give you some tips, some advice, some sentences that you need to work on. So you will get a feedback from 2 different points of view, and you will see which one you like it more, and you will see by yourself. It's really very good because you're getting 2 feedback from 2 instructors. No one is doing this. You are getting one-to-one MOOC, but in fact, it is two-to-one MOOC. 2 instructors are giving you feedback. Everyone is giving you a feedback on 3 cases. Then the mega MOOC, and this is we started that one about 6 weeks ago. Some people like to do a 12 case exactly like in the exam. In fact, the mega MOOC is much more difficult than in the real exam, and I will tell you why. The mega MOOC, you are doing 12 cases. However, you are spending at least 4.5 to 5 hours in the MOOC. You are doing the first MOOC in a circle. You are doing a 6 cases with role players, and then you are doing a 6 cases with the instructors. That makes it 12 cases. Then the 6 cases with the instructors, you will have the feedback at the end. So you will have to sit for 1.5 hours extra to listen to the feedback. So in total, at least without any IT problem, at least you are sitting for 4.5 to 5 hours for this MOOC. It's harder than in the exam, because in the exam it's about 4 hours, and that's why it is very good, because you are practicing your body, you are practicing your brain, how you will be fully aware, fully alert for more than 4.5 hours. Some candidates took it. I think I posted, guys, a feedback from one of the colleagues from Nigeria who done the Combi MOOC and who done our crash course. I posted that video on the WhatsApp group and Telegram group. He had that MOOC and he had a very good feedback about the MOOC. It was really very tough, but it worth it. It worth it if you are that kind of people who get stressed easily in the exam, lose the focus because you are sitting for 3.5 hours, 4 hours in the real exam. Try to practice on 12 cases back to back. It's tough, but it's worth giving you the experience of having a very difficult day in your life. The only you MOOC, the second one, guys, you do the 6 cases back to back, but you are getting the feedback exactly after the exam, or exactly after, straight away after you've done the 6 cases. You take only 5 minutes or 10 minutes break, and then you come for the feedback. They are giving you a detailed feedback about every case. Not only this, it can consider as a mentor session, because we are giving you some advice about IPS, about shared management plan, how you can build confidence, how you can pick up the cues. So you can say it is not only one-to-one mock, in fact, it's also mentor session as well. Then we have different types of mocks, but those are the main 3 ones that people like them the most. We have observer mock. Some people just attend for observation of one of our mocks. We have a study partner mocks as well. We have done it before. Some people liked it, like you are doing the mock, but your study partner attending the mock with you. So the study partner can see how the feedback is given. And sometimes even you can swap between you and your study partner. You can do 3 cases, your study partner can do 3 cases. We have different types of mock. We always can tailor the mocks, guys, according to your wish. That's not an issue. The most important, you get a very honest feedback. Okay, most of them are really very tough feedback. Unless you are having the exam after 2 to 3 days, it's really very hard to give you a hard time before the exam, especially you are going after 2 to 3 days. We just give you some tips, how you can adjust some of your techniques, how you can verbalize a management plan in a good way, how you can give options, all of that. Then study partner or study partners is very important, because unfortunately, guys, many of you, they don't select the study partner very wisely. You should consider your study partner as you are in a short-term relationship with him. So you need to select them very carefully and very wisely. If your study partner, guys, is giving you a very easy feedback every time, well done, you've done a very good job, amazing, all of that is not good. It's not giving you a very tough feedback. So I highly recommend change your study partner. When I was practicing with my study partner, we were commenting in the body language. Okay, even if I was doing like this in the consultation, we comment on the body language, on the tone. When did you start your management? When did you ask about ICE? Did you do all what they are looking for or not? So it was really very tough feedback. Even the night before the exam, it was really very tough feedback. So try to start looking for a study partner early, because you might struggle to find a very good study partner. This is the most important step to start for your SCA preparation. Find a good study partner. If you are starting, guys, 3 to 4 months or more than 3 months before your exam, I would suggest, guys, start your study group 4 to 6 people and do some practice with them every day, every other day for a couple of hours. So at least you will listen to 6 people, 4 to 6 people. Everyone has different approach. Everyone has different consultation skills. Try to listen to them. Try to listen to different approach from 4 to 6 people, and then try to make your own approach. Try to make your own approach. See what are the phrases that you find them very easy for you to verbalize, to say to the patient in the exam. Once you have this, once you have started your study group, and then you started with 4 to 6 people for 1 or 2 months, after that you need to cut them down. Go for 2 to 3 people. Make the circle closer so you can practice on more cases. And I highly recommend, guys, that 1 month before the exam, you only need 1 good study partner to finish as much as cases as you can. Especially, you will need him to practice almost on a daily basis, at least few cases every day. You read the notes, you listen to the course, and then at the end, guys, you go for 1-to-1. You practice with your study partner 1-to-1. And why 1-to-1? Not 2 to 3 people in this group in the 3 to 4 weeks before the exam. You need to finish as much cases as you can. If you can, guys, find a golden egg in your group, that will be good. In my opinion, a golden egg. Retakers are very important, guys, for you, because they have very good experience. They know the exam very well, and they know that the exam is how the role players are doing the stations. So if you are practicing with them and they are acting as a role players, they may do it very nicely, exactly like in the exam, because you already saw before how was the role players. Was it tough? What kind of clues that, what kind of cues that they are giving? What kind of questions they like to ask? Because some role players, or most of them, they like to ask many questions in the management part. Okay, so retakers has an experience. Retakers have experience about the exam. So if you find one who sat for the exam before, try to practice with him. Female is also good, because Females by nature, guys, they have better communication skills, especially in showing empathy, all of that. And if you have someone with good English, that is really good, especially if you have someone who is like second generation here, or they have very good native English, that is really good. If you can find this, I was lucky because in my study group, I had one. I will never forget her. She was really very helpful because her British accent was really amazing, and we did learn from her many things and many phrases. So study partners, guys who are looking for September, going for September, if you didn't do that, start from today, look for a study partner. What is your aim? Because you need, guys, a cases that you need to practice on. For, in my opinion, SCA revision website is okay to start with. Okay, many people have different case scenarios like doctor's note and patient note. It doesn't matter. Go for anything or anywhere that you can practice from. SCA revision is, I found it very close to the exam. Why? Because the doctor's note in the SCA revision are really very good. The doctor's note in SCA revision are really very good. They give you very good cues in the patient notes, in SCA revision, and unique cues in the exam. Unique cues while you are practicing with your study partner. So SCA revision, the patient notes are very good. The management is okay. The management is good, but in my opinion, it needs to be a little bit more organized, but it is good. So SCA revision, you probably can practice on the cases from SCA revision. Practice on different scenarios, guys, rather than all the cases if you don't have any time. So if you don't have time, don't practice on all of the cases in SCA revision. I think now there are more than 300 cases or 320 cases. You don't need to practice on all of them, especially if you didn't start early, you don't have time. But there are common themes that you need to practice on. For example, hypertension, you need to practice on a hypertension case. Atrial fibrillation, you need to practice on an atrial fibrillation case, heart failure case. So from every category, try to practice on one case. Woman health, so contraception is very important. You need to practice on a contraception case, how you can tell an options, how you can verbalize many options to the patient. Again, for HRT, all of that. So try to practice on different scenarios or different themes rather than all the cases if you don't have any time. Then read all the management and history taking part very well. And that's why we made a very good notes, guys, based on CKS guidelines, history taking, management, how to approach, how to explain every case. Okay, so I highly recommend, even if it is not from our notes, the months before the exam, guys, try to read all the management tables, all the management notes, all the options that you need to tell the patient in the management in the 4 weeks before the exam. Try to read them at least twice, because that will be refresh the options of the management in your mind. So very important, you have a source, you read from the source, and it should be, in my opinion, an organized source. For example, woman health cases, all of the woman health cases in one place. MSK cases, all of them in one place. Pediatric cases, all of the pediatric cases in one place. Why? Because when you come in the few weeks before the exam, you need to systemize your head. You need to be very systematic. For example, today, I will revise all pediatric management. So you will open one chapter, you read all the management for pediatric cases, and so on. Guys, try to do with your study partner few mocks. Okay, not only depending on a specific academy or a specific team, your study partner, the months before the exam, if you can do mocks with your study partners, that will be good. For example, you can make a 12-case mock with your study partner. You do 6 cases, your study partner does 6 cases, and you swap, and you take 10 minutes in between as a break, and then you give each other feedback at the end. That's what also I did before my exam, because that time we didn't have big mock or something like that. So I did practice with my study partner in this way. We done few mocks, 12 cases, 6 cases each before the exam. Then again, the week before the exam, try to revise all the management again. That's why if you revise the management in this month, the 4 weeks before the exam, try to finish, guys, revising the management early so you can revise it again the few days before the exam. And then the last day before your exam, if your exam is tomorrow, so just revise the main parts that you are always struggling with. For example, if you always forget about HRT options, try to revise this point. If you forget about something in particular, your weak points or your weak topics, try to revise it in the day before the exam. Okay, and then you can probably practice only 1 or 2 cases the day before or the night before the exam. And my advice, try to finish everything by 8 p.m. The night before the exam. Forget everything, just go and sleep. I mean, like, forget that you are having exam tomorrow. You don't want to stress yourself out. Okay, just relax. Maybe you can spend some time with your family, watch any TV program, just relax. Okay, and then leave it. You've done very well job. If you followed all of this map all over the few months before the exam, you should be okay to go for the exam. You've done your mocks. You had a very constructive feedback. You had assessment from different people. You read all the management notes. Okay, you practiced during your daily sessions. I think, guys, if you've done all of that and you build up a very good consultation techniques, you should pass the exam. You should pass the exam. Which board? Whiteboard is very important. Whiteboard, guys, for the exam is very important. So I had these 2 boards before my exam. I put the red one and I put again after that the blue one, because the red one was really very small for me. So at the end, I ended up using the A3 size whiteboard, the A3 size whiteboard. So I choose the A3 size whiteboard because that was bigger for me to write what I need to write. How you write it? That is where, guys, I started how to arrange or organize the whiteboard in a very effective way. So the whiteboard, and Dr. Fata will speak in more details about this, you should divide it into 2 halves. 2 halves. So the first half, as you can see here in the left column, this half you will never wipe this. You will leave it through all the 12 cases. We are the first people to explain, and we are the first people proudly to explain to all the colleagues, guys, start preparing your whiteboard after your ID check. I had my exam in June 2024. I asked many people when I should start preparing the whiteboard before I went for the exam. They told me in the 3 minutes after, in the 3 minutes before the 12 minutes consultation. And for me to write everything on the whiteboard, I would be distracted because I need to read the doctor's note in the 3 minutes, focus on the doctor's note, take what I need to take from them, and start organizing what I should ask, what I should use or say or reflect on the doctor's note. So my top advice, and I tried this in my exam, it did work. After I came out of the exam, we started to tell all the colleagues that they are going for the exam. Even we started to tell in our course, and we are the first people to explain that. And thankfully, it did help many people. After you finish your ID check, guys, no one again will ask you, show me your whiteboard. What does that mean? Your ID check, you might be the luckiest one. You will have your ID check, the first one in your circle. So you will have about 30 to 40 minutes after your ID check and before your exam starts. Try to use this 30 minutes to make your whiteboard. Okay? You might have 30 minutes to make it. You might have 5 minutes to make it after your ID check. It doesn't matter. Start your exam after your ID check. Once you finish your ID check, start organizing your whiteboard. For me, that was a structure that I was following in my whiteboard. Dr. Shatta, he had the main concept, but he tried to modify a little bit of this. This is the main idea from my side. You guys always write what you do struggle in the whiteboard. So I will tell you just a few tips about it. So always start with open questions. That's why I wrote this. History of the presenting complaint. Okay. Then I start asking about thoughts. And I wrote, guys, as you can see here on the whiteboard, I separated ICE, okay, in 3 different lines. Many people write ICE as one word, and when it comes to the mocks that they have done with us, what we have found, they only ask about ideas. They can ask about concerns or expectation, but many of them, they forget to ask about all the 3 questions about ICE. They wrote ICE as a one word. My advice, try to separate them, ideas, concerns, and expectations in different lines. Not only this, as you can see here, I didn't put them back to back. One of the good techniques, okay, try not to ask ICE back to back, otherwise it will sound robotic. Just try to integrate them in the consultation. Sometimes the patient will come and already will tell you in the opening sentence, you would like a sleeping tablet. So you know already the expectation. This is one of the examples, okay? So you know already the expectation. So don't ask him what you are hoping me to do for you today? No. Apart from the clone, are you hoping for anything else? Because you need to reflect on the patient. You need to be a very, very good listener in the exam. If you come again back and ask him, well, what can I do for you today? And he will repeat himself, well, doctor, I already told you I need a Zopiclone. So that shows the examiner you are not good listener. Apart from cancer, is there anything else worrying you? Apart from the scan, is there anything else you are hoping for me to do for you today? And all of that. Then family history, if it is applicable, menstrual history, plus or minus, if it is applicable, social history, just write what you always forget. So I wrote over-the-counter medication, for example, definitely work, alcohol, smoking, drugs, driving, if you forget about driving, okay, and it is applicable, for example, obstructive sleep apnea, very important to ask about drive. MI, stroke, very important to ask about drive. OTC, and I wrote the OTC on the whiteboard in my exam, because the night before the exam, I done one case with my study partner about inflammatory bowel disease. And I forgot to ask about over-the-counter medication, and he was using ibuprofen over-the-counter. That is a real thing. That's why you put on your whiteboard what you usually forget. That's why I forgot to ask him about ibuprofen in any over-the-counter. So I put on my whiteboard over-the-counter medication, OTC. Impact, I also sometimes forget to ask about impact. And in the IPS course and the situational management, we are teaching different approach, different ideas, how you can ask about impact. Don't be robotic and ask, how is impacting you? How is impacting your work? How is affecting your work? How is affecting your daily life? It's very robotic. Again, remember, in this exam, they are marking you against British colleagues. British colleagues very rarely to ask how this is affecting you or impacting you. No, there are many ways that they ask about impact in a very nice and indirect way. Then the management, I always, guys, and we are the first people to have this approach and adopt this approach in our courses. And proudly, other people also started to follow the same approach. Because this approach, if you follow, guys, believe me, you should get a high score in the management. So in the management, ICE, start with ICE and diagnosis. This is the first line in the management. As you can see here, management, ICE and diagnosis is the first line. We'll come to this in more details. Or not in more details, in a brief details, because in more details, it was already in the IPS course. Then things patient can do, things that we can offer the patient for face-to-face bloods, face-to-face examination, bloods, medications, referral, leaflet follow-up, all of this that we can offer him, what he can do, usually lifestyle medications, over-the-counter medication, and safety advice. Then these guys, you will never wipe this during your exam. The blank part here, you will wipe it between every other case. You will wipe this blank part between every other case. Right. Then a very, very important here, guys, to know about what are the common mistakes that different people do in the exam. And by the way, the extended course, in the mini mocks, you will find the same mistakes people are doing, and you are commenting on the mistakes they are doing. That's why extended course, they will show you what are the mistakes your colleagues usually do. And by the way, we will do, okay, and you will do. So you listen what they have done wrong and what they were supposed to do in a correct way. So people forget to ask about ICE. Believe me or no, I have done yesterday only a mock. Not yesterday, sorry, day before yesterday, only a mock for someone who was sitting in June after 2 weeks. So I have done 3 cases in the only mock, and my other instructor, my colleagues and other instructor in the academy done the other 3 cases. So I done 3 cases. 2 of the 3 cases, they forgot to ask about ICE. They forgot to ask about ICE completely. And the case that she asked about ICE, it wasn't complete ICE. It wasn't complete ICE. And when I asked her, show me the whiteboard, she was writing ICE as one word. That's why I told you, don't write ICE in one word. Separate them in 3 different lines. Otherwise, you will forget to ask about one station, you will forget to ask about expectation, other station, you will forget to ask about concerns, and so on. Better to separate them. That's, guys, not from my point of view, but this is what we have seen for hundreds of colleagues over last year. We have done hundreds of mocks. Many people still struggle to ask about ICE. I don't know, it's very simple, very easy, But some people under exam stress, sometimes they forget. Then you don't address the eyes in the management. You don't address the eyes in the management. And believe me or no, even I have done some today, even in the morning, I have done only a mock with someone. Again, they forgot to address the eyes in the first line in the management. Even not in the first line, sometimes even they totally forget to address the eyes at all in the management. I'm worried about cancer. I'm worried about reflux. Why it is not reflux? Why it is not cancer? You should address my concerns. You should address my expectation. Why you are not giving me sleeping tablet? You should address that in the management. The best time in your management is the first part in your management. Start your management addressing the eyes. Why I'm telling you that? For two reasons. The first reason, you need to be a patient-centered consultation. That's why you will start addressing the patient eyes. Second reason, if you forget to address the eyes in the first part in the management, and your patient is giving you hard times, asking you many questions, you may forget to address the eyes in the management, because patient will start asking you many questions, so you need to reply and answer him. So if you didn't finish eyes and you finished it addressing the eyes in the first part in the management, and patient would give you too many questions, sometimes you will not have time to address eyes, and you probably will stuck with his questions and answering his questions. So finish eyes in the first line of the management, better for your consultation. It will be more patient-centered, and you already addressed his eyes. Then many people, unfortunately, and here where many people unfortunately scored low in the management and they don't pass the exam. They know the station very well. And guys, who here doesn't know the management of hypertension, atrial fibrillation, diabetes, all of that? All of us know that. And what happened in the exam? You are telling the patient, I will give you one medication. I will do 1, 2, 3. So you are giving your patient instructions. You are not giving the patient options. So you are listing for him the management that you already studied or you read before. So you would like to finish your consultation by telling him as much as you can from the points that you already know in your mind. This exam is not about this. In fact, again, our Nigerian colleagues who passed this exam, if you listen, guys, to his video, who done the 12K smoke with us, he had the exam before, and he had the exam after he joined our academy. And he mentioned that in the first exam, when he didn't pass, he spoken too much in the management. Even he said many things in the management. In the second time, when he passed with us and he scored 95.5, that was just last week, the results came last week, he didn't speak that much in the management. In fact, he just gave few options, didn't speak that much, and let the patient choose. And this is a trick that many people, unfortunately, struggle to follow in the exam. And then you come asking us why you failed the exam. Because you didn't give your patient options. You are listing the CKS guidelines to the patient. You are giving him, I will give you 1, 2, 3. You are listing the management plan. They are not looking for someone who is listing a management plan. They are looking for someone who is involving the patient in the shared decision, a shared decision making. Very important, guys. Again, guys, they are looking for someone not listing the management. You are sharing the management options, letting the patient decide. A shared decision between you and the patient. Then not smiling enough. Many people, unfortunately, they don't smile in the exam. I don't know. I don't think Dr. Shata has attended yet. He will know that. I think his first attempt was not smiling. When he passed the last time, he also scored 95 and half or 94 and half, something like that. He was smiling through all the stations. Guys, your smile is very important to build a rapport. Group player will like you. They will start opening up, telling you their hidden agenda, give you some easy cues, all of that. Please, please, please smile. When you should not smile, if you are telling your patient breaking bad news or you are showing your patient empathy, don't smile. At least neutral face or show a sad face with no tone. Okay, believe me, I will never ever forget this. Someone was telling me one of the big mocks, I was marking one case in the big mock, and it was suspected cancer, suspected multiple myeloma. And the doctor was very smiling all the station, but he was smiling during the breaking bad news, which I felt very, very weird. he didn't appreciate my feeling that I really feel shocked now and I feel sad. You're telling me probably I'm having cancer. At least doctors should not smile during breaking bad news. Or I would say even telling a chronic condition like diabetes, hypertension, stroke, or something that your patient will suffer all of his life. He will be on long-term medications, and definitely someone with diabetes, hypertension, all of that, they will have multiple complications down the line if the blood pressure or blood sugar is not controlled. So smile all the stations, but when it comes to breaking bad news, giving a chronic disease condition, try to make your face neutral. Your tone should go less. Then I hope one of the colleagues attending today who done this mistake, referring or seeking advice and guidance in many stations. I will tell you something, guys. They are looking for a safe consultation, but being a safe doctor doesn't mean you need to refer or send advice and guidance for any patient you are seeing. I'm a safe doctor. I will send advice and guidance to secondary care, or I will refer to secondary care, so we'll make sure there's nothing wrong with you. No. They are looking for someone who can treat the patient. You need to take responsibility and treat your patient. Okay, being safe doesn't mean you need to refer your patient. No. Being safe, you treat your patient and you safety net him when he should come back if something wrong happened, if he developed any of the red flags. That is a safe consultation. I will treat you, you give him the options, you give him the treatment options. After that, let him choose. But if something wrong happened, you safety net him against red flag, he should come back. As long as it is not two-week referral, it is not emergency situations like acute coronary syndrome or a stroke, okay? Try to take responsibility and treat your patient in primary care before sending advice and guidance. Unnecessarily referrals, it can make you fail the station in the exam. Believe me, I don't know, guys, here if someone is repeater or retakers, okay? And if someone is retaker, you probably have this feedback from them. Unnecessarily referrals to the secondary care. They are not looking for someone who is referring everyone. Then a common mistake that many people do, even until now, taking the first mock near to the exam. Guys, my top advice, even if you don't want to remember what I have told you during this station today or during the session today, please, guys, before you pay 1,200, take one good mock and get a very constructive feedback. Then you decide, are you ready to pay 1,200, or you will give it more time, 1 or 2 months more, to prepare and to be well prepared for the exam. Don't pay the money and then come before the exam by very near, like few weeks or 1 or 2 weeks before the exam, taking your first mock. Always take the first mock before you pay the money, and then get the feedback and see the feedback report. How many ready stations, how many fails you had, how many passes you had, how many clear pass stations did you have, all of that. Then you will realize, are you ready or not? And remember, the feedback that you will get from Big Mock is not from one person, it is from 6 instructors. 6 instructors, most of them, guys, if not all, passed the exam with a score more than 90 or 100. Okay, so they know what exactly they are looking for. Top advice, guys, to evaluate yourself. Again, take the exam first mock at least 2 months or 3 months before your exam. If you are going for September, I would suggest taking it at the end of middle of June, first 2 weeks of June. At least you will know what are your weak points, what are your strengths and strong point. Because weak point, that is your homework over the coming 2 weeks. Sorry, over the coming 2 months. So please, guys, don't put us under stress, because what happened, people are going for June. We had a significant influx and significant request of people requesting mocks because they are going for the exam after 1 week or 2 weeks. We are trying to accommodate everyone. We are trying to even expand our team, trying to accommodate as much as we can, but don't put yourself in a situation that your exam is after 2 weeks and you are going for the first mock and you are getting a very harsh feedback because many things you are doing wrong, so you will stress yourself. Take your first mock before you pay the 1,200. Especially 1,200 is really very high amount. Then what the examiners are really looking for, Guys, I took this slide. By the way, guys, I'm happy to share the slide on the Telegram channel. So I'm happy to share all the presentation on the Telegram channel with all of that we are telling you. So don't worry about this. Don't worry about taking a screenshot. I will share the presentation of today with all of you guys on Telegram channel. So it will be saved on Telegram for the newcomers to have easy access to that one. So the examiner is looking for someone who is safe. And we mentioned that, guys, being safe doesn't mean you need to refer everyone. Being supportive, showing empathy, okay, to the patient, smiling on the station, unless you are breaking bad news. Able to share options. Please, guys, don't list a management plan to the patient in the exam. Don't tell him, I will give you a tablet. Tell him one of the options, okay, that this is a medication option. Are you open to try some of them? Are you open to try it? Okay, because we are now not in IPS station or IPS session. There are many ways how you can share options. Even here, guys, even here as a gift from our side, we put for you these two tables, how your management plan should be. How your management plan should be. Please, guys, this should be your map and your guide during your practice over the coming few months or few weeks if you are going for the exam in June or September or October or whatever. In fact, even if you are doing this style in your daily practice, you will find even your consultation very smooth, more patient-centered. Your patient is satisfied from your consultation. All right. Again, as I mentioned, guys, they would like a GP who can manage and take responsibility. So don't refer unless it is really very, very necessary, like 2-week referral, as we mentioned, or you are in front of emergency situation. The management plan, the ideal management plan, and this is the approach. We are the first people to teach the approach because it is the easiest approach to help you guys to smash the SCA exam and to get a clear pass in the management. You have two wings or two ways for a management plan. Being a patient-centered consultation and patient-centered management plan and shared management plan. Patient-centered, you address the eyes in the beginning. And we wrote for you guys here some of the sentences. You probably can use this. We have more sentences in the IPS workshop. The other one, shared management plan. Shared, you are giving options. Your role, again, is to offer options, not to give instructions. A very easy way, you list one option by one option, and between every other option, you tell him, how do you feel about this option? How do you feel about that? What is your opinion? Are you open to try this between every other option? If you don't have time, you can give probably 2 or 3 options together, and at the end, you can ask him, among these options, do you have any preference? Or which one you prefer? Or which one you would like to start with? Okay, so different people, different approach for how to make a shared management plan, how to list an option. We talk about this in more details in IPS workshop, and we give you opportunity to participate and try yourself how you can tell me a shared management plan during the workshop. We give you a case scenario. We tell you, for example, HRT. Tell me how you can make a shared management plan for HRT, for contraception, for whatever, for chronic condition, and so on. So you probably can use this as a guide for you guys if you are practicing or started to practice or looking for a study partner. Try to use this approach, how to make a management plan in the way the examiner is looking to hear it from you. Believe me, it will help you a lot in your SCA preparation, SCA exam, in your daily consultation. Few more tips, guys. Few more tips. Don't depend on fixed case scenarios. I hate if someone is just have a fixed mind. Personally, I like to have a very solid background, have good knowledge about all the topic, and then you need to be very flexible in the exam. Could be very tricky. Okay, so you need to be aware of the guidelines, and then you, as long as you have good information, good knowledge, no case should stand in front of you, even if the case you don't know it. I remember in the exam, I had a very new idea. I never practiced on this with my study partner, and then I got clear pass in this station. Why? Because I am prepared in advance. It doesn't matter. It doesn't matter. Okay, like if it is a case idea that I saw it before in my daily practice, or I did practice with my study partner, or totally some new idea that I never saw in my daily practice. It doesn't matter as long as I'm very flexible. I follow the approach. I share my thoughts with the patient. It doesn't matter what kind of cases you have, even if you had a rare disease in your exam that you never saw before in your daily practice. And one last step, guys, please try to help each other. Please, guys, try to help each other. So the best among you are those who are the best for others. This is what I believe in. So always try to help each other, try to help your colleagues that they are retakers, didn't pass the exam, try to help your study partner. Here, guys, free materials. Okay, free materials. If someone would like to go for or see the free materials, you will find free materials for many things, for AKT, for SCA. We'll try to add more free materials on a regular basis on our website. Also on the Telegram channel, you will find many flashcards on the Telegram channel as well. Why we started to put them in the Telegram channel? Because newcomers can have access to the old files. On WhatsApp, unfortunately, if someone came new, they can't access the old files. All right. And this is, guys, the QR code for our groups on WhatsApp or Telegram. If you would like to join our group on WhatsApp, you probably just can scan the code. The same for Telegram. You can scan the code. Once you register in the channel, join our MTS family, you can have access to the free materials on Telegram. Also, you can attend many free sessions. We are doing a free session as well every month, probably every week, every other week. We are still doing free sessions. We had free session last week or week before. We are having a free session tomorrow. Okay, we will post the link on Telegram and WhatsApp. And the next crash course session will be on either Tuesday or Wednesday. We wrote it will be on Tuesday, but we might do it on Wednesday. We'll see according to the schedule and our work. Okay. Any questions, guys? We should have probably a few minutes of questions. If you think I didn't answer any question in your mind, you probably can start asking me until our successful candidate will join. Guys, anyone has any questions at all?
Hi, doctor. Can I ask a question?
Yes, sure.
Yeah. So, I know one you mentioned was your crash course. The other one, the big course. What's his name?
It is on the website SCA course, but we'll change it to SCA extended course. So it will.
Yeah, the extended course. Yeah. So, when are you starting this course? Because I'm planning to sit in September, and I want to get the resources in good time so that I can go through them.
Good. Everything now on the website. Once you register with the course, okay, guys, let me show you how it looks like the website, because it was also on my agenda. I will stop presenting this and I will show you. Once you register, you will have the access already to the course. You will have access to the material itself. All right. So, guys, here is the website. Here the website looks like. Okay. So let me just enlarge the screen. So this is if you don't have account, you can make account first. But if you don't need account, so you go, right? Then you can find some feedback. We started to put some of our feedbacks. There are many thousands of feedbacks that we got before, hundreds of feedback. We couldn't accommodate them because I need to go all the way through all the chat to get the feedback. Just we had some of the recent feedbacks that for people to post. If you would like to read some of the feedbacks, we just started to post SCA feedback. Right, so you can find probably some of the video feedback and then SCA feedbacks. And for AKT, we'll add the feedback for AKT later on. Maybe later this week, I will add some of the AKT feedback. So if you would like, guys, the courses, here from the courses up, you will find a free materials. First of all, free materials, you can see many for SCA. A free material from crash course about mental health. Again, miscellaneous 3. We discussed many different topics in the crash course. This is extended course session, ENT and Minimook. So at least you can see how the Minimook is done, how is the feedback. Allergic rhinitis and sinusitis. We done it last week. It was free session. People attended. And there is an SCA simulation pulonitis. I have done this case as a doctor, and I had one of the role players. So at least to see a demo case, how you can run a consultation. This is just an AKT. We will add here dermatology. If any one of you guys would like to attend or listen to the dermatology, it will be for free. So for the courses itself, if you go down, more courses. You just write here SCA. Right. So here you have the crash course, for example, and you have the extended course. For example, this 4 weeks
Screen
extended.
is frozen, doctor.
Sorry, screen is frozen. All right. Sorry, guys. I don't know how to. Let me make it again. All right. Okay. Okay, guys. Sorry. Open a new tab. So again, quickly, here is the feedback. If you would like, the feedback. Once you open the feedback, it open another slide, but that's fine. If you can, guys, go to the courses down. Here, for example, the SCA crash course, SCA extended course. This is the SCA extended course. It will be the same for the crash course. Once you register, guys, you go to the curriculum, you will find all the sessions. For example, gastroenterology, if you open, you will find here the video, and then after the video, you will find the PDF file. You will find the PDF file. Okay, so once you register, you will have access to all the curriculum, all the courses, materials, all the course materials, videos, and PDF files. The extra thing in the crash course, you will find audio file as well. You will find audio file. It's just how to navigate through the website. Right. Any other questions, guys? Right. Let me check if Yusuf attended. Yes.
Hi, I was just wondering about sort of how to. So I'm planning to sit for the exam for the October diet. So it's just trying to get organized in terms of booking the only you mock sessions.
Mm-hmm. All right. So if you are sitting in October, I think probably around July time, you probably can text us and try to book any only you mock. So it will be, as I mentioned, with 2 instructors.
Okay,
If
thank
you are
you very
going to
much.
October, you can book in July.
Okay, thank you.
All right. Okay, guys. Any other questions? I'm trying to find. Second. Yes. Any more questions? Yes, SA.
Yeah, so we're just asking about the communication skills course. It's not on the website. I can't see anything there.
No, it is not on the website. It is different. It's a workshop, and yes, it is a live one. A live session. Not
So
recorded.
how do we book for it?
Just text me, and I will book for you a lot for the coming weekend.
Okay, thank you.
Yes, no problem. All right, guys.
Just one more question. So the extensive course, is it recorded sessions or live sessions?
Recorded. Everything is recorded on the website, so you can listen at your convenient time. And
Okay,
we have
thank you.
regular updates as well. So we still, from time to time, we have, for example, the week, I think early last week, we had also a live session for extended course. We are trying to also include more cases to the extended course. All right, guys, shall we take just 5 minutes break before our other candidates will join as well? Okay, just 5 minutes break, and then you probably can listen to their tips and advice as well. How did they pass the SCA? Some of them didn't pass from first time. What did they do different the time that they passed? How did they change their approach for SCA, study materials, all of that? We probably, guys, can take 5 minutes, and then we can start. Right. Guys, we have Dr. Michael with us. He will start his talk in 2 minutes. If anyone would like to ask any questions before he starts. Dr. Michael, he also joined our team and our academy. He did join our academy, I think, recently, and he did pass in March. Dr. Michael, if you would like to start, it's okay. If guys, anyone has any questions before Dr. Michael will start, you can ask.
Yeah, I can start now. If you
Okay, Dr. Michael, yes, yes.
okay, that's fine. So yeah, so nice to see you again. It's quite like 1 month ago. Yeah, I just want to share my experience. So this is a point. Maybe sharing some tips as well for my colleagues. Let's start with the journey. So what happened is it was my fourth time, my fourth attempt. So it was the last one really to attempt the exam. What happened really is the first 2 attempts, there wasn't actual preparation for the exam because I was preparing for another exam really for CSA. Like 1 year ago, we didn't have any, I mean, right scenarios, right, let's say resources about the exam, or maybe right idea about what this exam needs. So to be honest, in the first 2 times, there was no preparation in terms of IPS or this exam really. They prepared myself for the complexity of the exam. The third time was very, very near to pass, but unfortunately it wasn't successful as well. In fourth attempt, I managed in April. I did the exam, and a few days ago I got the results. So thanks God, I passed the 12 stations. So I got in management 12 stations pass or clear pass, 8 and 2 and 4. The 12 stations and 11 stations in history, pass or clear pass, 11 station in IPS, pass or clear pass. There's only one fail in only one station in history and interpersonal, but even I managed to pass this station in terms of management. So even I got 5 in this case, which is, I think is good score as well. So it's okay. Just Dr. Amr asked me to share some tips with you. In the last 1.5 years, I got all the courses, but I can't really say the names, to be honest, because it's quite unethical to say names of the courses, because really each course adds something to me. So like the IPS, the knowledge itself, of course, the management tips, maybe approaches about the exam. So I can't really say the names if it's okay. I attended the course, and really I couldn't attend in person because I have some family commitments. But what happened? I attended the recorded sessions on the website, so the normal one and the crash course as well. And I found them very, very helpful, to be honest. With just to go to nitty-gritty, the good thing with this course, or maybe the most different thing with this course, it's based on immigrant approach. So if you are IMG like me, I'm from Egypt, by the way. So if you are IMG, so it can be helpful for you to have course like this. It's kind of to be honest, really, you need some phrases to use to express your knowledge. Sometimes even you need some knowledge. Sometimes really, we as a GP, you can't be confident in every kind of medicine, every branch of medicine. And for me, for example, I'm not very good in gynecology. I was hating gynecology, to be honest. It was so bad for me. I can remember first time I did the exam, gynecology case was I looked like I was someone for first time dealing with gynecology case. And even this very important. The examiner likes to see you very confident. You should act as if you dealt with the case 10 times before, even 100 times before. You should be very confident. If they feel like you give the right answer, but you're quite hesitant or not confident, or looks like, oh, this is the first time you saw this case, yeah, you might fail, unfortunately. It's quite subjective exam, to be honest. Kind of subjectivity in the exam. I would recommend for you. I'm not here to give advert about the course, to be honest. It's but Dr. Amr is one of my friends. But to be honest, it's I would recommend for you some tips for the exam. You can you can see. So I'll give you 2 golden tips about the exam. I tried it in the third and fourth time, and it really gives very good marks when I tried it. Try to justify everything. Justify, like rationalize your thinking, why you're asking this question. During the history, even you need to justify. You need to justify why you think this case having this diagnosis. Well, for example, if I'm talking about gout, why I'm thinking this patient has gout or rheumatoid arthritis, for example, whatever the reason is, and why this case has gout. Is that like lifestyle? Is that genetics? Is that smoking or alcohol, for example? And also justifying why your management plan going this way. Sometimes in SCA we have two different. I can see, or both of us can see the same case, and we might have 2 different management plans, and both of us can pass in the case. But it depends really on how can you justify, because the examiner cannot understand your thought process. You should verbalize your thoughts. Because when I say, for example, for this high blood pressure, I should give doxycycline, for example, but you should say why you, or justify why did you choose this option for the patient. Okay, just kind of verbalizing, because otherwise the examiner will say, okay, this is the right answer, but what is the process? What is the mechanism? How did they or how did this person or this doctor reach the answer? Is that like because he knows the records, for example, or he knows someone did the case before or passed the case before, or just by chance? Because there is nothing really by chance. You should justify this point. The more you justify, the more you get more and more marks. Maybe this is I would say the only time, or the only mechanism really, or the tip I use to get clear pass. In all cases, I get clear pass in the exam in the 4 attempts, is to justify. Even if you go against these guidance, you should justify this point. But really, I can't give examples because it's very difficult to give examples for this. The other things is to double reflect, is to have 2 layers of eyes if you can. But this can be very helpful in mock cases. If someone's saying to you, for example, I'll give you a very quick one, but I hope really I'm not wasting your time. I apologize, Mr. Dr. I apologize. But
no, they need all of these tips, guys. Yeah, it's very, very good to share with them. Thank you, Dr. Michael.
I'll be very quick. If someone, for example, coming to me and say, I got headache, and this is very virtual scenario, is not exam scenario, but very common to happen, of course. If someone's saying to me, oh, this is brain cancer, or I'm worried, doctor, about brain cancer, you should double reflect it or double act on it in two layers, really. In the history, you should reflect on this point. Oh, sorry, I'm very sorry to hear about this, but brain cancer is a very big word. Why did you think about it? What's the reason behind that? Is that one of your friends got it? Oh, I'm sorry about your friend. Is he okay? I'm hoping is fine. Okay, but brain cancer can present with other symptoms, not just headaches. Did you have any blurring of vision? So at this point, really, you take history in context of eyes, or to be honest, you ask questions in context of patient needs or adapted to patient needs, and then you double eyes again, or double reflect on eyes, or re-reflect on eyes again on the history in the management, for example, like saying, look, I can see you very worried about brain cancer, but The good news today, you don't have any other symptoms of brain cancer, just headaches. And normally, brain cancer doesn't present with headaches, except in very late stages. So you use ice twice in the case. To be honest, ice can be double ice as well. Maybe ice of the patient, maybe ice of relative, ice of his daughter, for example. They might say, my daughter asking me to come today, or my wife asking me to come today. So what did your wife think? Or is there any consent from your wife's side? So there are many eyes really in the case. The more you get, the more interpersonal skills you get. So it's not only eyes, it is not only get eyes or asking about eyes, it's mainly how to reflect on eyes. All of us will ask about eyes. All of us will ask about eyes. And sometimes if you don't ask, the simulated patient will give you this in management section. So doctor, do you think it's not hypothyroidism, for example? Doctor, do you think I need endoscopy? Doctor, do you think I need some medications, for example? So they will come back to eyes. Everyone will know eyes in the case. Everyone, to be honest, or most of the cases. But the point is not to know eyes, is to how to reflect on it. I recommend for you to build up your knowledge, whatever the source is. But the source here, of course, I have my own sources because of the exam, for this exam, because I did many courses and I have my own knowledge as well. Because I passed ATT without preparation. So it's completely different a little bit. I got like 83% without preparation in ATT. But of course, it's different from one-to-one. But you need to know at least some phrases. You need to know the most important questions or how to get focused history. Because if you ask many questions, or if you ask any irrelevant questions, yeah, it's not enough in the exam. It's not the more you ask, it's all about the more relevant you ask. And as I said, you need to justify sometimes your questions, why you ask this certain kind of questions, or give reasoning or rationalize this point. I would say really the last step is to do mocks. And to be honest, don't get me wrong, I'm not saying do mocks with Dr. Amr. But yeah, by the way, it's up to you. But the good thing with this practice, with this academy, is they offer two kinds of mocks, or even more. They can offer for you one mock with real simulated patients, with real actors, which is something very similar to the exam. And also they offer for you the only one mock. I used both really, to be honest. The only one mock, you do it with Dr. Amr or one of our colleagues to give you immediate feedback. You do the 6 patients, and then you get the feedback on 6 patients. I found both useful. Maybe the only one is much better. When I speak to Dr. Amr, maybe much better, but it's up to you, of course. This kind of, mixture of mocks, this can be helpful. Of course, this is just kind of personal experience. And of course, I hope the best for everyone, really. I'm sorry, just talk too much, really.
No, not really, Dr. Michael. All the best, and congratulations again. And very, very, very good score, 94 or 95, which is really very, very good. Well done for that.
Yeah, it was very. I would say it was very good surprise, to be honest.
Congratulations, and wish you all the best for your CCT.
Yeah, thank you.
Thank you, Dr. Michael, for participation. Because guys, we are a little bit behind the schedule. Dr. Salma, she's here as well, right?
Thank you.
Yeah, I am.
Hi, Dr. Salma. Hi.
Hi.
Thank you for joining us today as well. Guys, Dr. Salma has also a different experience as well, and she did pass with more than 90 her score. She done a really very good job. I will let her speak, okay, about her experience, about her opinion about imtiaz, comparing to others as well, what could be been offered, or what we have offered or done different. All right, Dr. Salma, we'll let you speak.
Yeah.
Yes.
Thank you, and thank you so much for what you've done for us. I think we are lucky finding imtiaz on our preparing for the exam, because I do believe myself this is the only course you'll find everything, guys, in this. I'm not saying that just to advertise for this course, but really, honestly, this is my feedback. So I'm Salma Tayyib, trainee in Leicester, due to CCT in August, in a couple of months. I'm struggling with my portfolio now, but yeah. So my first attempt was in January, and I couldn't make it by half mark only. It was a shock. I was not expecting that. Um, and when I get the result, as everyone, I was very disappointed. And then I just decided, I spoke to this is what happened, what you advise me. I can't, I remember how he supported me, and he just said, the positive things that you almost pass. So half mark is mean that you are ready for the exam. Do it as soon as possible. So I emailed the RCGB. I told them, listen, guy, I can't wait for the May. If there's any way to give me a seat for April, and unfortunately, yes, they accept that, and they send me the link to book, and I book it in April. So I started preparing for the SCA November, October, and I started by the one of the famous courses, and as everyone advised me, I did that course, and at the end of the course, I told my colleague, I'm not satisfied, something missed. Honestly, I'm kind of people they like to have one source. I don't like many sources or many courses and notes and a lot of I found that it's just not suiting me. So I decided to looking for another course. At that point, Amr was presenting his free sessions, and I noticed in the sessions that the note he is putting in the screen, it's very organized, the way that I like to use for my preparation. So I just did for 1 month the course and the extensive course, and immediately I felt like this is what I want. This is what I'm looking for. So I did the extensive course for 3 months, and then I did the MOOCs, started by study partner MOOCs. It was really, really helped me have an idea about the exam. It was my first shock. I remember in the feedback, there was, I missed all of the cases almost because I was very anxious and surprised by what this exam. This is not what I expecting, but it was, I started from that day after the study partner MOOC. I realized what this exam is not about the knowledge only. And then I did the all you MOOC. I can't forget what Mohammed and Dr. Masr their feedback, it's really helped me a lot. And since that day, I just did what they advised me. So after my first attempt, the only thing I did in my second attempt, I did the crash course, because was very concise and like the summary of everything that I just wanted to revise for the exam. So I just I asked Amr to send me the notes. The only thing I did from my first attempt and second attempt is I just revised the notes, the paper, the printed copy. I just study all of these notes, revise all my knowledge, and I focused on the feedback that given to me. I would say, if you like me, you don't like many resources and many courses, do any course. I would advise extensive course because it's really helpful. The way is, at the end of every system, there is a MOOC, mini MOOC. So I found it very useful because, for example, if you finish the endocrine and then you had like 2 or 4 cases like a mini MOOCs, that will help you how you will do the data gathering if the case from endocrine, for example, mental health, and every system had a different way of data gathering and management. So I found it very helpful, extensive course. But if you not have a time, trust me, crash course is more than enough, because already I know everyone have a good knowledge from AKT and from day-to-day activities. And I did remember, I mentioned something. I got one patient in the practice came in with thrombocytosis. Platelet was more than 1,000. and I was fresh at that point, just revising the hematology from Amr's slide. And when I saw the case, the result, I did a debrief with my supervisor, and he said, no, that could be just reactive for the iron deficiency anemia or infection. But I said, no, Salma. Amr mentioned that this case, we need to speak the hematology on call, and we need to do things like rule out. So I did what Amr advised, and surprisingly, that patient had CA lung. We will miss it if I didn't make that. So I use it even for my day to day. Honestly, I don't want to repeat things that already Michael mentions. He mentioned a lot, but my advice, guys, please don't make this exam, because it really affected my confidence when I first time I missed it. I couldn't make it by half mark, but it's really impacted how I feel and how I'm confident about myself. And I do imagine how that affect everyone here, especially the retaker. Please don't let that exam affect your confidence, and just do what they wanted to do. They want you to do. First of all, smiling make a huge difference. I passed all of my related to other clear bus or bus by just big smile. It really will make a huge difference. Number two is start the management by addressing the eyes. Mr. Smith, I know that you came in worried about the cancer, but let me explain to you from this and this and this is not a cancer. This is possible this, and then share your management with the patient. That will really give you a high mark and clear pass in the management. And lastly, please, guy, if you're planning to take the mock, take it early. Don't leave it to the end. Do it early, 2 months, minimum 1 month before. Because trust me, even if you are confident in everything, so you feel like you are good in your skills, this guy that will give you a feedback will really help you with the practice with your colleague, and that will make the difference. Please don't leave the mock to the end, because you will be like, if you did it a week before the exam, you will feel very depressed by the comments and the feedback, and that don't have a time to address it. Do it early, and really, this is what you need. And again and again, thank you. Thank you, Dr. Masr. Thank you, Muhammad. A lot. It's really, there is a effort. It's really clear how you guys doing and maximizing your efforts, doing all of these things to help us. I really do appreciate every single advice and words and every case. Amber made it at in the notes. I was just in the exam, just said that, mentioned that, it's just like on my background is always. But thank you so much, and wish you the best. I'm pretty sure you will be more and more success in the future, because you do that from your heart. It's not just a business. You really, I can feel how you want to help us, especially other IMGs, as Michael said. Thank you so much, and I'm happy to help anyone need any advice more.
Thank you, Salma. Thank you so much. Guys, if anyone has any question to Salma or to me before Dr. Shatta will start his part as well. If no questions, okay. Salma, thank you so much.
No worries.
Well done for
Wish
passing.
you the best always.
Thank you so much.
You. Bye.
Thank you. Right, Dr. Shatta, you here?
Yes, hi.
Our genius guy with IT stuff. All right, Dr. Shatta, we'll let you speak. I don't know, Dr. Shatta, if you can share the screen from your side or not. Let me stop sharing from my side. I don't know. Can you share it?
I'll give it a try.
Yes, amazing, Dr. Shatta. So I will let you lead, okay? So as I mentioned, guys, Dr. Shatta also passed SCA exam with, I think, 94, 95, or even more. Dr. Shatta also done with us some mocks, attended sessions, and done very good effort actually on his in his exam. Just one comment before I leave him. He also did comment that smiling in the exam did help him. The same as Dr. Salma said, and the same that I told you guys in the beginning today. Smiling is very important in the exam. I don't know, Dr. Shata, if you would like to also add this as well.
I
And
totally agree. Yeah.
yes, okay. And guys, I will let you. He just had our whiteboard idea. He modified a little bit. Again, guys, I told you it is not fixed. You can tailor the whiteboard as per your weak point, strong point, all of that. The most important, start your whiteboard preparation after your ID check. Don't wait until the exam starts. Your exam start already after your ID check. I will let Dr. Shata lead, and I will listen to him as well, guys, with you. Dr. Shata, thank you for joining today, and the mic with you now.
Thank you so much, Amr, for introducing me, and thank you for your nice words as well. I'm here to give our colleagues some guidance on the new concept of board engineering that we're introducing. Although we're not inventing the wheel here, because most of our colleagues already have their own structure for using the board in the exam, but I'm hoping that this will be a valuable addition today. So as you can see, I'm hoping everyone can see the board structure. This is the structure I used. I believe it's not the most complicated. It's quite simple. We'll go through it item by an item. I guess most of us now know that you can utilize the fact that there are different types of pens available to use on the board. Some of them can be wiped, dry wipe by the tissue, and others need wet wiping. So you can use these to the wet wipe to put the structure as you can see it on the screen now after you do the ID check, and then leave it for the 12 cases and use the dry wipe pen which is usually a different color, to add what you will add during every case, mainly during the 3 minutes reading, and then you wipe it after the case, and you do that 12 times. I'm hoping you got my point, and I'm hoping you've already tried that. But let's go through the structure then. Starting from the left, you can see the name and the age. This is very important, actually, that you don't forget to take the name and the age of the patient from the information that you got in the 3 minutes, so you can address the patient directly by name. You can confirm the age. I did start it by saying, hello, this is Dr. such, and calling from the GP surgery. Is this Mrs. or Mr. XYZ, and can I confirm your age? Thank you so much. How can I help you today? And then I get some introducing voluntary information, and then I ask, can you tell me a bit more about what's been going on? These are two open questions, and that's why I put OO. Try to follow me now. I'll try to do it quickly because it can take a lot of time if I don't. So the double O on the left is two open questions, and then I analyze the complaint, which is the A that you can see. All of you know the Socrates for the pain. If there is any pain, I use it. If there is not, I don't. And by the way, from now on, I'll use what I need to use of the structure, and I leave what I don't need for every case. You'll know what I mean as we go. So the A is analysis of the complaint. The I is an impact. I've actually wrote the whole word impact. I didn't use that a lot in the exam. I just used one letter because I know my structure. I memorized it. Then the FH is a family history if it is relevant. And I raised it and put it here because sometimes it's very relevant and I wanted to remind myself to ask about it early. And then the DD, the differential diagnosis. Sometimes it's very important to think about the differential diagnosis very early. Let me give you an example. If the case is like chronic cough, you know, you can go down different routes with the chronic cough. It could be postnasal drip, it could be reflux esophagitis, it could be different things from different systems actually. And then the P is the periods. Again, I've put it early because it can be relevant in a female patient in a non-gynecological case. Then go down to the I's. I've just wrote the word I's, but then the arrow points to the right, and on the right half of the page there is the I and the C and the E. So I use the word I's to remind myself to ask about the I's, but whatever the patient says, I write it on the right side at the top. Does that make sense? I'm wondering, Amr, am I very quick, or shall I carry on this rate?
A little bit slow will be better, please.
Right. So ICE, ICE, just to remind me to ask about the ICE, but I write the details of the ICE on the right side of the page, just to give myself more space. Then the S is the social history. If you'd like to write down, yeah, you can do that. Otherwise, I guess this will be available as a recording. Amr, is that right?
Yes, yes, it would be.
Yeah. So the S for the social history. The social history is split into a mnemonic that I made, which is how sad life is for this patient. If you look at the other side where the arrow points, it's HWOSAD and life, how sad life. So H stands for home, O stands for other people living at home, W is for work, S for smoking, A for alcohol, D for drugs, illicit drugs, and then life is split into FES, like food, exercise, stress, etc. And you can add more things in the lifestyle that can make a difference that you would like to ask about. So the S in a circle on the left to remind me to ask about the social, but whatever I gather from the patient, again, I'm writing on the right half of the page. Then the R in the circle is the red flags, to always remember to ask about it. Again, just as Amr said that we can raise that a little bit up if you wish, ask about it a little bit early, or ask about it in this exact order. Just remember to ask about it. That's the most important thing. I've split it to two, as you can see, the triangle and the eyes. This is because I ask about red flags of the diagnosis I'm thinking about, but I also ask about the red flags of whatever the concern of the patient. Let me give you an example. If the patient is coming with a back pain and I'm concerned about coda equina, for example, I'll ask about weakness in the lower limbs and problems with opening the bowel and passing urine, etc., which is the coda equina. But I also ask about weight loss and loss of appetite, etc., because the patient did ask me, could it be cancer, doctor? So I'm asking about the red flags of the patient's eyes. Why am I doing this? Because later on, when I reach the point of explaining the diagnosis and the management, I start by asking, by saying, like, Mr. Smith, I don't think you have cancer because you don't have this, this, and that. I do think, though, that you have this because of this, this, and that. That's why it's important to ask about the red flags of the eyes, in some cases at least. Again, the rule is I use, among these items, I use the ones I believe is necessary for my case, and I skip the ones I don't want to use for the case. So we are at the R in the circle at the moment. Then the PDAF. PDAF, it stands for past medical history, drug history, allergies, and family history, if I didn't ask about the family history yet. For the PDAF, mnemonic switches to the P-bind if this is a child, and the P-bind is just on the right of it. And of course, you know the P-bind, don't you? It's the pregnancy, birth, immunizations, nutrition, and development. So when you use this structure during your practice, weeks before the exam, it's not difficult, and it's very, very, very handy and convenient to use, and makes the practice of MOOCs easy when you're doing it with your colleagues as a role play. You'll get used to it, and you'll know what I mean. So you'll pick either the PDAF and write down, or the P-bind and write down. Then you move to the T in the circle, which means tried. What did you try so far? If the patient has already tried, let's say, naproxen for something, then you know that you'll try something else. So it's very important to know what the patient has tried so far, like OTC or home remedies as well. Then the triangle below that, which is diagnosis, to remind you to say, verbalize the diagnosis. Then the E and the E is explanation of the diagnosis and empathy. Of course, explanation of the diagnosis and with explanation of whatever management we will do is a huge subject. And I guess you've already had access to the explanation genie that we can talk about in or we can see about it in the group as well. But back to the structure, the diagnosis, don't forget to verbalize the diagnosis. Even if you're uncertain, you can just say it. Let's go to the right side of the page, the ICE. You will have something written there now because you did ask and you jot down what the patient told you. You'll find whatever you have filled in the spaces in front of the HOWSAD, the HOWSAD. If it is a palliative care elderly end-of-life case, you will add to the social the DOLs that you can see on the right side. So the D stands for DNA, CPR, A for anticipatory medications, A for advanced care planning, L for lasting power of attorney, S for the SR1 form, the money bit. So the DOLs is something that you will use once in your exam in the case that relates to palliative care. If you ever get one in the exam, you'll very likely get one. Then go below the line, then there is a horizontal line there. The M in the circle just says that this is the management bit. You start the management by de-ice, which means deal with the eyes, like remove any concern or deal with any concern and expectations. It's very important to remind you to de-ice the patient before going on for the options of management. Then comes the option. See how many items below the option that you need to go through. At least 8. F to F, are you going to invite the patient for face-to-face? You need to tick these boxes. You need to remind yourself to answer this question. Am I going to invite the patient for face-to-face or not? Am I going to do tests or not? That's the second item. Med is medication. What medications am I going to offer? Then non-medication. Am I going to offer some self-help advice? Am I going to advise the patient to use any service in the community, etc.? Then the R with a tiny circle just above it is the referral and the degree of the referral. Is there any referral I'm going to make? Is it going to be 2-week wait or urgent or routine? Then the I, the little I in the circle, is information. It reminds me of the leaflet. It's very important if you're going to mention any leaflet to mention what is in this leaflet, not just a leaflet that you will throw at the patients. Specifically, it will be nice if you refer to a specific website, like for the MSK versus arthritis, etc. Then the follow-up, then the safety netting. Although sometimes I do the follow-up and safety netting a little bit early in the management, but at least you need to make sure you're ticking these boxes. Use your pen to make a tick beside everyone to make sure that you're not missing anything. The last bit is what you can see on the lower right part of the page. There is a list there as well, starting from support driving. I'm hoping that you're following me by now. So support means what support can the patient have in the community? Can you suggest contacting the family, or can you refer to the social services for the patient to get carers, a care package? Then driving, does the patient drive? And is that relevant to this case? Are you going to advise the patient to stop driving? Then the SOAP, the SOAP, I call it the SOAP of work. If the patient is working and it's affecting his or her work, then are you going to offer S or O or A or P, which is a sick note, or the occupational health department at work to be involved, and the patient can do that themselves, or A, which is amended duties, or the P, which is the social prescriber? Consider it everyone in every case, if relevant. Then the OT, the occupational therapist, any role here, and the PT, the physiotherapist, and the DN, district nurse. So what you do, that's the structure. What you do is you keep selecting what you need. You go through them one by one and make sure that you're ticking the ones and using the ones that you need and skipping the ones that you don't for every case. Using the structure effectively during the 3 minutes that you have for every case when you still have not met the patient yet, but you have the information. And some of us will have 3 minutes and 45 seconds. Using these 3 minutes or 3 45 effectively to put what you can put on the board is what we nowadays call the board engineering. You can put a lot on the board. Sometimes you're presented with some information that gives you a clue on what the diagnosis will be. Sometimes it's a photo of a dermatological condition and it's a spot diagnosis really. So you have the diagnosis in hand in the 3 minutes, and you can engineer the consultation based on that. You can really put every single red flag you want to ask about and every single question. You can even think about what support the patient can get in the community and what can be done for work, etc. You can decide that you will not bring the patient for face-to-face, so you'll cross that out because you think that you've already made the diagnosis through the picture that you have. You can do a lot in the 3 minutes on the board. That's what board engineering means. I hope that helped. Yeah, I'm all done.
Yes, well done, Dr. Shatta. I hope, guys, you find another way how you can organize your whiteboard. So you have two different things for the whiteboard organization. The one I showed you, the one Dr. Shatta showed you. Again, you can make your own engineering or style of your whiteboard based on what you usually forget. Even sometimes during the mocks, we tell you, you keep forgetting this. You should write this on your whiteboard very clearly, and so on. So Dr. Shatta's approach, any approach you find is very effective for you, is really good. The most important, guys, again, your exam start after your ID check. So your whiteboard engineering will start after your ID check. Believe me, it will save you time. It will save you. It will relieve your stress during the exam. All right. Okay. All right, guys. If anyone has any questions to Dr. Shatta. Yes, KI.
Hi. Yes. Sorry. Can you please explain what is DD here on the left-hand side of your board?
Differential diagnosis.
Oh, so you ask it quite early then, these questions.
Pardon?
So you would ask these like differential diagnosis questions quite early in the data gathering.
Yeah, if you think that it will steer the conversation towards a different condition. I give the example of cough because it could be something related to the chest or the stomach, etc. So sometimes it's very relevant to think about the differential diagnosis and maybe write what differential diagnosis do you have in the 3 minutes to ask about it. I'll be honest, it's more relevant if this is an MRCP examination when preparing you to be a general medicine doctor. I've been through that myself, but it's a little bit less relevant here because it's more about the social side of the case rather than the medical side. But I've put it here just to consider. Do you have a wide differential diagnosis? Do you have to ask about different things, or is it just as simple as somebody who has uncontrolled diabetes or somebody who's coming with an upper respiratory tract infection and that's it? So it's something to consider.
Thank you so much. That was quite helpful.
Thank
No
you,
way.
Dr. Shatta. Let me check. Is Dr. Yusuf is here? I'm just checking. Because we guys have Dr. Yusuf as well. Would like to share his experience. He's having a unique experience. He's a Canadian one, and now he's in Canada. And he finished his exam with the result, and after few days from having the SCA cleared, he got his CCT, and now he's in Canada. He will join shortly, guys. We'll give you a very good tips as well and advice about his experience. It's really very, very inspiring story as well. Yes, Samar, you would like to ask something?
Yeah, I want to ask Dr. Shatta for the FES on the right hand side. Beside how sad life FES, what does this stand for?
Yeah, details of the lifestyle, including food, what the patient eats, exercise, what kind of physical activity the patient is doing, and what can the patient add to the physical activity, stress, how much is the patient stressed, and could that be causing the symptoms or could that be a result of the symptoms? It goes either way, but it is relevant in social history.
Thank you so much.
Right, Dr. Shatta, have you done? We probably need to organize another session, guys, with Dr. Shatta as well to speak about the role of AI in preparing for SCA exam. especially he is having one of the integrated tools for his work on our MTS website. How you can explain the explanation genie. You probably, Dr. Shata, can give a brief in couple of minutes about it if you would like. Just how to use it and how it can at least the starting point of explanation genie as well.
Oh, thank you for asking about this. The idea started when one of the trainers told me that he used to try and practice explaining conditions while driving to and from work. So using this time to verbally practice explanations of conditions. And this trainer is like native English speaker, UK graduate, etc. So I said, well, probably IMGs need that even more than UK graduates. So I thought about how we can use the time that is wasted in commuting, and use that time to practice and untie the tongue tie, as we say. Some of us even have, well, I guess most of us speak English as a second language. So this is where the explanation genie came from. It's AI-based application that you can speak to as a voice chat feature to give the AI application the explanation of the condition and also explanation of the management plan in one go. And then the AI application gives you rating for your explanation based on 3 KPIs, key performance indicators. One of them is the simplicity of the explanation. The other is the clarity of it. And the third is its compliance with the NICE guidelines. The application actually gives you a percentage, so it can tell you you're scoring around 80% in the clarity, and this is the way you can improve on it. Do you want me to give you my own version of the explanation to help you tweak the phrases and the explanation a bit, and then you can say yes, or you can ask for it? Could you give me your version of the explanation so I can try to imitate it? And then you can go back and forth and train more and more and more. You can give the application your own explanation again, and the app gives you feedback again in cycles until you're satisfied that you have reached more than 90 or 95% on each of the KPIs. As you can see in the group, I guess hundreds of trainees are using it now, and I got positive feedback about it from one of the Royal College examiners, and I'm hoping it will help more. No, Dr. Moeed, you don't have to download it really. Once you click on the, well, you do have to have the ChatGPT application on your phone to be able to use it. That's it. But once you click on the link that you can find on the website of MTS or on the WhatsApp group, then it should run.
Okay, can you stop sharing, Dr. Shata? So I will try to share from here just to show
Yes, please go on.
How it appears on the website. Right, 1 second, guys. We'll get you to the homepage. Here we are. Right, so I think if you go down, guys, somewhere should be here. Well, I'm trying to find it. It was supposed to be somewhere here. Let me go up again. But I will double check, guys, with the IT team. I don't know where did they put it, but usually it will be a tool here, guys, on the homepage. Once you click on that, you can use it and you can practice on how to explain. I'm not quite sure where it has went actually. Well, I will try to find it, guys, but it will be here. Once you click on that, it will open your ChatGPT and you can start practicing on that one. Once it is there, guys, I will let you know on the group. Sorry, guys, I don't know where is it.
The link is on WhatsApp group.
Yeah, it's a link on WhatsApp group, yes. And it was supposed to be on the homepage. It was actually on the homepage, but I told the IT do some little bit notifications, but I don't know where did he put the link. So we'll go back to him again. He's a tough guy giving me hard times, but don't worry, guys. We'll try to sort it on the website. All right. Dr. Shatta, thank you too much for your joining today and sharing your really experience, especially with the whiteboard engineer. It's really very helpful, especially whiteboard guys. For most of us, is really very important in the exam. I know some people don't use it that much, but other people really use it, and it does work. It does work. All right. We have now we have now with us Dr. Yusuf from Canada, and I will let him share his experience. I know the time zone is significant between here and Canada, so he might be in a noisy background. Dr. Yusuf, if you would like to share your experience with our colleagues before we end up today webinar.
Hi guys, thank you, Amr, for having me on. I think I managed to get a quieter background now, but we'll see if any interruptions come in. So just a little bit about me. I've recently CCT'd. I was in the Northumbria GP training program, mostly around the Newcastle area, but it does cover like a wide part of the Northeast. And I'm here to just give a bit about my experience with preparing for the SCA and the role that I got, that MTS provided that was very helpful. Firstly, if we want to talk about preparing for the SCA in general, there are a few things that is fairly universal, which is getting enough experience, seeing enough patients and things. I did for myself notice, for example, when dealing with COPD patients, after I actually saw COPD patients in clinic, it became much more comfortable for me to deal with them on exam situations. So one aspect would be definitely to make sure to try and write it, to try and do the SCA at a time that is reasonable, like that you've gotten enough clinic time. There is a feedback that I was getting from different supervisors that comes with a caveat when it comes to getting experience. I tried to take time off to study for the SCA, and I think that's a good thing to do. And sometimes I'll get pushback from different people saying the advice we get is that clinic experience is the most valuable thing, getting more experience with the patient's most valuable thing. And sometimes they don't like it, don't like people to take time off to prepare. They think it's counterintuitive. And that, I would say, that is useful to a point. So as the thing I've just mentioned, where you get the experience in the different types of patients. For example, I didn't get to see palliative care patients until ST3, so dealing with these kind of patients on the exam, it's a lot more theoretical. So I would agree with this thing that the schools tend to give, where you need experience to the point where you see the variety, but you do need to sit and practice, and it would be useful also to take some time off to practice for that. And when it comes to preparing for it, there's two aspects. There's the knowledge and experience aspect, and then there's the actual performance aspect, like where you're applying the knowledge in the way that the examiners like. So I've done different things, different ways for preparing knowledge-wise. Firstly, getting experience in the clinics, actual patients, preparing for the AKT, and then other courses where they go through everything as well, through basically all the course material. But there is something additional that Imtiaz gives, is they have a well-rounded approach. They can do the full course things, but I can only speak about my experience, which was really good on three aspects. I did the compressed course. I'm not sure if there's a different name for it. The fast track, the compressed course, and I did the mocks. And the things that are gone through the courses, like they are relevant to the exam. And there is, I would say, to take the compressed course after after you're already familiar with the full material. So if this is the first time you're going through all the material, all the different topics, you know, all the different domains and topics, then the compressed course is too dense. But if you've already done it and now you've already revise these things and you want to revise them one more time before going to the exam and get some really good tips on how to approach it, then taking this dense compressed course is good because you're not gonna have to try and retain everything, and you can focus on relevant to the exam. If you retain all the information, is to give yourself time to take the longer course. This is all from the theoretical side. From the mock side, from practicing with friends and things like that, it's very important to get feedback. Try and get different people, different types of colleagues to study with, and don't try and be too nice with each other with the feedback, because in the end you want to do well in the exam. You want to know where you need to improve, and you want to help your friend to know where they need to improve. With the mocks, usually when we're studying with colleagues, it's with other medical people, and this has its advantage where they can help you out with things, but also when you're actually doing the exam, the disadvantage is the patient actors, simulated patients are not medical, and they do tend to act differently. So this is kind of an advantage we have with the big mock that Imtiaz that I noticed when I did it at this academy. Basically, the big mock has six stations that you're going through one after the other, and they are paid actors and not medical. So the interaction I noticed was different, and it's a bit more real. And you get, if I remember correctly, you get feedback on each thing that you did, detailed feedback in a few days. There's the only you mock. This is you doing 6 stations with 1 or 2 other simulated patients, but they are medical. The advantage here is that you get the feedback right away. So the other one, the advantage is you get more you get more like exam condition because it's the right type of patients and things. A bit of disadvantage is sometimes you can't recall exactly what you did, so you're trying to you get it in the feedback and you're trying to recall where I did this in the feedback. With the only you mock, it's again like with colleagues because it's all medical, but you get feedback right away, and the feedback that I've received, they give it in an Excel sheet, and it's exactly what you need. And I would say until it's shown on the feedbacks you're doing. I did so many of these mocks, by the way. I was doing like one by the months. I was doing one like every 10 days. But I've been studying for a while. I've had to repeat the exam, and this was like an all-in thing for me. So I really invested, and Imtiaz like really helped me pass this time. So it was really good. Until you see that the mocks you're getting feedback that you like, that's another tip I would give. Wait for the exam, like don't write it unless you're okay to write it again or something, until you get the feedback that you like from them. Because another aspect is as it's hard to perform your best during the exam condition. So you try to even aim a bit better. And this was something I found is that they pushed me to that top. They were like, you can be a bit nitpicky, but you need to be at the absolute best because you're not going to be at your best on the exam. It's a little more nervous. There's a little more technical problems. So what made the biggest difference for me overall, there were so many strategies to preparing for this, but what made the biggest difference is knowing when I can write it. because even if you're doing the wrong things, you can get there slowly, you can get there slower than others, as long as you don't write it until you're getting the proper feedback that you need. And they do give, like, you will see from the detailed feedback in the Excel sheets, everything that was really good and everything that needs improvement. And you pick up patterns, and when you have it all written down, it's easier to see these patterns. So that's like the take home in the end, is wait till you get an approval seal. They won't give it to you but you can pick it up when you see the feedback, and and you can ask them. I was a bit cheeky, and I asked, can I write it now, and things. So try and do that.
Right,
If
thank
anyone
you.
has any questions, feel free to let me to ask.
Thank you. Dr. Yusuf, you already relocated to Canada, right? You went back to Canada.
Yes, yeah.
Right. So you just like you did fly quite soon after your CCT, after your exam,
Yeah,
actually.
I CCT'd on like April 11th, and I took the flight April 30th. I don't know. I had like a card that I just sold for a little less so that I can sell it quickly. But yeah, I've uploaded documents and things, and the process is going okay.
Right, good. Congratulations, and congratulations for passing SCA, and I'm happy that we did help to some extent to
Thank you.
pass the SCA. Well done for that, Dr. Yusuf, and all the best in Canada. Hopefully you find a very good offer, and yes, and all the best. All the best for you guys, all of you. Thank you, Dr. Yusuf. If no one, guys, has any question to Dr. Yusuf, I will let him go. All right. Thank you, Dr. Yusuf, and yes, thank you for joining us today.
No, my pleasure. Thank you.
Thank
If
you.
anyone has questions for me at a later time, you can send it to Amar, and he can connect us.
Yeah, absolutely.
Okay.
Right. Thank you. All right,
Bye.
guys, I think we came to the end today, and I hope, guys, today we just give you a quick tips about how you can start the planning, or how you can start preparing for SCA exam. Take your time, guys. Don't rush for booking the exam without knowing for sure that you are really ready for the exam. Otherwise, you are losing 1,200 for just a trial. Okay. Let's start early. Find your good study partner. Know your own style. Okay, in the communication skills that will be easy for you to apply in the exam. Okay, some phrases, some sentences, all of that. If you need any help, write on the group or text one of the instructors. We are more than 8 instructors in the academy now. Some of us already an educational supervisor now. Dr. Shukri, he also did pass the exam with us with very high score after joining our academy, and he is an educational supervisor and a safeguarding lead in his practice, and he's also planning to move back to Canada as well very soon. So we have a good experienced team. We have Dr. Irbaz as well. So I'm thanking and like saying thank you for all our instructors. We have a good range of instructors. We have from Pakistan, we have from Canada, we have from different places. So thanks for all of them, guys. They are really doing a very hard job to help you guys passing the SCA exam, give you very good techniques, very good styles, find your easiest approach early. Okay, practice with your study partner, take mocks. It doesn't mean it needs to be MTS or any mocks, guys, that you are finding it very effective. You have a good feedback about them from your teachers, go for that. Take any mock. Doesn't need to be with MTS. Anyone, guys, give you a good feedback. Take the mock early before you pay the money for the exam. If they tell you are ready, go for it and book the exam. If no questions, guys, you should go. All right. And tomorrow there is a free session. We'll post the link on WhatsApp group. We'll discuss few stations or few cases from your daily practice, common daily practice. And yes, we are here, guys, to help on the WhatsApp group or Telegram. If you text me on privately or one of the team as well. Right. If no questions, guys, all the best and good night.